Hey, good morning. I'm Vic Senese and welcome to UroNurse. Today we're focusing on a health crisis that is not getting nearly enough attention. Black men are being diagnosed with prostate cancer earlier than ever before, and the data behind it is alarming. Hey, and be sure to like and subscribe to our channel. Prostate cancer already ranks among the most common cancers in men worldwide, but in black men it behaves differently. Not only is the risk higher, the disease is more aggressive and it is appearing at younger ages. Researchers now point to 7 key reasons, backed by science, that help explain why this is happening. Let's break it down. Reason number 1, genetic and biological factors. First, genetics and biology. Studies include research published in Nature Genetics that show that certain DNA changes, especially in a region called 8q24, are more common in men with African ancestry. These genetic changes can act like a gas pedal for prostate cancer, speeding up its development. Additionally, higher average testosterone levels, common in many black men, may further stimulate prostate cancer cells' growth over time. So this means risk can begin quietly years before symptoms begin to appear. Number 2, the tumors themselves. According to the American Cancer Society, black men are 1.7 times more likely to be diagnosed with prostate cancer and more than twice as likely to die from it compared to white men. Research also shows higher Gleason scores, meaning faster growing, more aggressive cancer, even in younger patients. This is not just earlier cancer, it's tougher cancer. Reason 3, risk factors are showing up earlier. Obesity, poor diet, lack of physical activity are becoming more common in black men in their 30s and 40s. The CDC links higher rates of obesity and diabetes to chronic inflammation, which may trigger hormonal changes that negatively affect prostate health. It's the perfect storm, long before prostate cancer is even on the radar. Okay, reason number 4, access to care. Many black men face systemic barriers to health care, including lack of insurance, limited specialists, and fewer screening opportunities. The National Institute on Minority Health and Health Disparities reports that inconsistent access often leads to later diagnosis, when cancer is harder to treat. This is not about personal choices, it's about structural inequities. Number 5, the environment and lifestyle. Many black communities face higher exposures to pollutants, industrial chemicals, and limited access to healthy foods. Studies consistently link high-fat, low-nutrient diets to increased prostate cancer risk. These exposures don't cause cancer overnight, but over time they push it into younger years. Number 6, screening gaps. A simple PSA blood test can detect prostate cancer early. We know that for years. Yet black men are about 20% less likely to receive regular PSA testing. Barriers include mistrust, cost, and lack of clear guidance. Cancers developing in the 30s or 40s may go unnoticed until they are advanced and dangerous. Early screening, often starting at age 40 or earlier, can save lives. And finally, number 7, family history and inherited risk. Yes, family history. 5 to 10% of prostate cancers are linked to inherited mutations, including the BRCA1 and BRCA2 genes. Black men with a father or brother diagnosed with prostate cancer are more likely to develop it, and develop it earlier. This risk is often hidden unless families talk about it. The takeaway is clear. Early prostate cancer in black men is driven by genetics, aggressive disease, and early risk factors, limited access to care, environmental exposure, lower screening rates, and family history. Science understands why this is happening. Now, here's the challenge: action. Earlier screenings, equitable healthcare, and access, and messages that truly reach the black community. They can change outcomes and save lives. Awareness is not fear, and awareness is always power. Hey, tomorrow on UroNurse News, I'm breaking down the science behind one of the most common medical questions patients ask, and separating fact from fear. You'll learn how much radiation dental x-rays really deliver. Did you ever think about that? Whether they could increase your risk of brain tumors? Safety tips every patient should know.
UroNurse Peter. Let's learn and share on YouTube, LinkedIn, X, and Facebook, everywhere.